if you have been struggling with your sleep recently, you are not alone. The NHS has recorded a rise of more than 10,000 cases from 2020 to 2024. So let's talk about sleep and sleep medicine. And adult ADHD specialist Dr. Bruna Sanader Vukadinovic is here with us. Very good morning to you. Thanks so much for talking to us. So what do you make of this rise in the diagnosis of insomnia? Are more and more of us struggling to sleep?
So I think the awareness of us, the awareness of how important insomnia is and the impact on our day-to-day life is what is on the rise. Especially we had seen both in the NHS and the private psychiatry clinic where I'm the clinical director during COVID. So insomnia is on the rise, but I would say primarily the awareness about insomnia and the impacts on our day-to-day functioning.
And does that awareness of insomnia kind of compound the insomnia? Because I know that when I can't sleep and I'm thinking about not being able to sleep, it makes it harder for me to sleep.
You're absolutely right. So the worrying about not being able to fall asleep or to wake up and not being able to function the next day, it's what makes insomnia even worse. And one of the main tips that we like to give both in the NHS and my private work is if you're worrying in your bed, if you're tossing and turning, the best thing is to do to get out of your bedroom even, and spend that time somewhere else. And only when you feel relaxed, sleepy again, to go back to your bedroom.
But don't go downstairs and start scrolling your phone. Just get
No.
If possible not.
We're all making notes of your sleep tips, by the way. We're very interested in this subject. People who get up incredibly early. But what is the main reason that people have sleep problems, would you say?
So that's a very important question. And I think when people think about sleep disorders, insomnia is just the tip of the iceberg. We all think, okay, I struggle to fall asleep, I struggle to maintain sleep, it must be insomnia. But what actually is the most important thing is a comprehensive diagnostic assessment to see, is it just insomnia or is it maybe an underlying sleep conditions? We are familiar with sleep apnea, restless leg syndrome. It can be all different kinds of parasomnia, sleepwalking, dream enactment. It can be a condition called circadian rhythm disorder, which is basically where our biological clock that controls when we feel sleepy and when we feel awake is misaligned with the outside world. So it can be so many different sleep conditions that are actually underlying and unrecognized, and having a proper comprehensive diagnostic assessment is usually the first step to success and to good treatment. And if you think you have just insomnia, follow all the sleep hygiene rules, and you're still struggling, that's often for us the cue, okay, something else is maybe going on.
And doctor, maybe we should cover our ears for this next bit, but like, what are the dangers of people who don't get enough sleep?
So thank you for this question, and I think that's the most important maybe message for our viewers, for our patients, is there is a big difference between sleep deprivation and insomnia. Insomnia is inability to fall asleep even though you have a good opportunity to sleep. Sleep deprivation is you can sleep, but you don't have the opportunity. For example, young mothers, that would be a good example. And insomnia, when you compare insomnia and sleep deprivation is far more dangerous. So I would just like to take that worry out of people and say, if you have a bad night or if you have a couple of consecutive bad nights, try not to worry. The consequences are not as awful as we can see in media and social media. Because like you said at the beginning, if we start worrying, our sleep will just run away further and further from us.
Don't worry, Anna.
Yeah, no, I'm going to try not to worry. And one other thing about ADHD, because I know you're a specialist in ADHD, and we've seen a rise in diagnoses. So is that something that can be related to sleep?
Absolutely. So that is also something that we often see at private psychiatry clinic. ADHD and sleep are interconnected, and if you treat just ADHD or just sleep, it's just going to lead to limited success. So we are specialists in both conditions, and the first thing is to do, like I said, a comprehensive diagnostic assessment. See, is it insomnia that a person with ADHD has, or is it circadian rhythm disorder? And one important thing to say, 1/3 of people with ADHD actually do have circadian rhythm disorder and not insomnia. And no matter how much sleep hygiene they do, it's not a lack of discipline or motivation. It's why they're struggling. It's actually an underlying unrecognized sleep condition. It's their biology.
Really interesting. Dr. Bruna, thanks so much for coming in to tell us all about it. We are fascinated by sleep here.
Doctor, leave your card because I've got a friend who might want to talk to you about some of
I will do that.
Sleep better. Thank you so much, Doctor.
Thank you.